This is Dr. Caudill Miller. We're talking about epilepsy, and today we're going to talk about the generalized seizures. We just did a series on the focal seizures. And the generalized seizures are classified differently. We're no longer using the term grand mal seizure. We're no longer using the term complex partial seizure with generalization. I think the vast majority of the generalized seizures we see in private practice would be a generalized tonic-like seizure disorder, or a grand mal seizure, or a complex partial seizure with generalization. That would be the vast majority of terms that we would use in the past 50 years. So people can have several different types of generalized seizures. They can have both generalized and focal. So they can have focal seizures and they can have generalized seizures. But generalized seizures are an abnormal electrical activity that originates from both cerebral hemispheres simultaneously, and it spreads to other brain neural networks. We now call them like genetic generalized epilepsy. There's a motor and a non-motor type. You have myoclonic tonic-clonic seizures, what we used to call juvenile myoclonic epilepsy. The arms will jerk, then a tonic stiffening, then clonic rhythmical activity. And then you have myoclonic atonic seizure. You see it with Deuce syndrome, brief jerking a limb or trunk followed by just the limb just drops. And the third one is the idiopathic generalized tonic-clonic seizure. It's not really in the new classification, even though it's mentioned all throughout like it should be, but it's not on their new charts. But I'm going to leave that in there because many of the patients we see will have generalized tonic-like seizure. This term remains. And then the generalized non-motor seizures are just the typical absence seizures, what we used to call petit mal seizures. So childhood absence or juvenile absence seizures were just acute, brief interruption of activities with a blank stare, sometimes eye fluttering, occasional deviation of the eyes that lasts seconds to minutes of rapid recovery. Third grader in school, every few seconds he's missing 3 seconds for an absence. He sits there, his grades drop, the teacher brings him to his mother brings him in. You get an MRI and EEG, just 3 hertz spike and wave everywhere. And you get atypical, the second type of generalized non-motor seizure, atypical absence. It's slower onset, but they have more changes in muscle tone during the seizure. That's not common with typical absence seizures. They still have the 3 hertz spike and wave, maybe a little bit less, like 2 to 3 hertz on EEG. The third type is a myoclonic absence seizure, just a few myoclonic jerks followed by an absence seizure. The fourth is eyelid myoclonia, sort of a forceful upward jerking of the eyelids. It can be seen with an absence seizure. And it can be stimulated by closing the eyes, stimulates it. Then the final seizure type are unknown. And I sort of didn't like this when it first came out, unknown seizure type, but I understand it now. It's just an unwitnessed seizure, such as a nocturnal seizure at sleep with a poor history. They wake up, they wet the bed, there's blood everywhere because they bit their tongue. Unknown motor, unknown non-motor, unclassified. So you just have to label that as an unknown seizure until you get a better witness of the next one. And that's generalized epilepsy and the new classification. And we're going to talk about the drugs we use. We're going to talk more about the workup later. So like, subscribe, comment, and more later.